All 6 implants he had placed in his lower jaw have fallen out, and 3 implants in his upper jaw have also failed. The implants here are also facing bone loss.
Hello, I'm Dr. Onur Utku Yüksel from Soho Dental Clinic. I am a specialist in implantology and periodology. Many patients come to us unhappy after having had implants done elsewhere. Sometimes they need revision implant surgeries due to uncorrectable aesthetic problems caused by incorrectly placed implants, and sometimes with complaints of pain and infection. In these revision cases, which are much more challenging than operations done from scratch, our greatest happiness is to restore the smiles and self-confidence of these patients who are in a dramatic situation. Now, I want to tell you the stories of revision surgeries for some similar cases.
Again, I want to share with you the story of another revision treatment. Well, this story is a bit dramatic because both husband and wife had implants done 2 years ago, and both of them experienced very bad outcomes. Afterwards, they came to us. We managed the treatment of these complications. First, I would like to start with the lady. This is the photo of the lady's mouth. All 6 implants she had in her lower jaw had fallen out, and 3 implants in her upper jaw had also come out. The implants here are also facing bone loss. Here we can see the patient's detailed medical x-ray image, which was taken at the time of their very first initial consultation visit. As you can also notice here, there is significant bone loss around the implants. All of them are within the black areas. The tooth on top of this implant has also fallen out. There is also bone loss like this here. All the implants on the right side, as well as all the implants in the lower jaw, had also fallen out in the same way, and our patient came to our clinic in a very distressed state. We immediately performed the revision surgery on the same day. Here you can see the revision surgery that we performed. Since there wasn't enough bone behind the area where the nerves are located in the lower jaw, we chose the All-on-4 concept. We position the implants in the back areas as close as possible to the nerves without touching them to provide maximum support for chewing. We place the implants, which are supported by long, dense bone and thick enough to bear the load of the entire jaw, in the ideal positions. Our job was more difficult in the upper jaw because there were many bone defects. Finding solid bone and placing an implant there, and at the same time relying on these implants to make temporary teeth, was really challenging. Here, you can already see the small pins related to bone augmentation. But fortunately, we placed our implants in an ideal position. The day after the procedure, we carefully fitted our patient with a set of temporary teeth, and as a result, she was able to smile perfectly and confidently. Here, you can clearly see how our patient looked when she first arrived at our clinic, the results of her failed previous dental treatment, and the temporary teeth that we custom made for her. 2 days later, this is how the patient left our clinic. Our patient not only paid for this treatment, but also dedicated time to it. In the same way, she had to pay and spend time on this treatment as well. Let me repeat, we are not selling implants. We perform this treatment with experience and with great care. If you have a treatment that has resulted in complications, don't hesitate to contact us. When choosing a clinic, patients' goal should not just be to buy a good brand implant at the cheapest price, but to find an experienced and trustworthy team capable of performing such delicate surgery. Don't gamble with your health by leaving it to chance at inexperienced businesses that only focus on low prices. If you think you need implant treatment or have any complaints about your existing implants, don't hesitate to have an online consultation with us.